So we know in order to become competent at airway management, a trainee must perform between 35 and 50 intubations. However, is just being competent enough? Let's take a listen.
You know this. If you take care of patients who need airways, the risk of complication from an intubation is high in some settings. And if you look between the ED and the ICU, the incidence of things like hypoxemia, hypotension, even cardiac arrest is as high as 40% when you look at some of these ICU-based studies. So we know that this is a high-stakes procedure. These are risky patients. And the challenge is kind of how do we train folks to manage these situations? When you look at what the ACGME says, both in emergency medicine and in critical care, they emphasize correctly, you have to be competent in tracheal intubations. But the problem is we all agree, yeah, you should be competent in doing this dangerous procedure. But what does it take to get to the level of competency?